Well, that's the big thing, isn't it? So let's talk about that. Look
Yeah.
after yourself, Carol. Hope all is well with you and your husband. So let's have a look at this then. What are the issues facing local dentists currently, especially NHS dentists? Dr. Avik Dandapat is a local dentist. And Avik, hello to you.
Hi. Thanks for
Okay,
having
so
me.
look at this. The pressures you are facing right now. NHS dentistry it feels like if you've got an NHS dentist, you're very, 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 very lucky.
That's correct, because we're quite limited as practice. I'm a practice owner on the amount of dentistry we can actually deliver, because currently the contracts are limited, because we have something called units of dental activity, and we're limited to a number that's assigned per dental practice. And once you hit your quota, we're unable to take on any more new patients. And owing to that as well, we've got waiting lists for patients who want to join the list, but there's just not enough NHS funding or NHS funding for dentistry going around at the moment, which is the biggest sort of difficulty in taking on new patients for us when we're already inundated with the patients that we've got.
It seems to be a constant refrain when this story does come around, and it does keep coming around. It seems to be the contract. So something's got to change. And I think MPs are alluding to the fact that things have got to change in the way that the NHS, the government funds NHS dentistry.
Yeah, absolutely. And the latest guidelines or latest report on the actual contract stipulates, they've not really come up with a solution, to be honest, apart from saying that they'll pay per capita patient that we take on, and they'd pay us more for taking on new patients. But that's just basically flooding an already flooded system with more patients and a strain on recruitment and the lack of dentists who actually are performing NHS dentistry. And the ones who are seeing anything between 30 to 50 patients a day, and expected to do a good job on having so little time with people. And it's very unfortunate to hear Carol's story and her inability to access a dentist whilst in pain. But it's an all too common situation at the moment.
Just finally, what about dentistry as a whole? Where are we at? You said, you're struggling to find dentists. So is the dental industry, dental students, are there less of them? Not so many coming through?
There are less of them. There are less of them coming through. I believe part of the reform is that we need more dentists who are trained up. We need therapists that are coming into practices to do more of the general work. I believe that Rishi Sunak recently said that he wants more therapists, and part of the reform that they've suggested is more people are trained. However, they really need to concentrate on actually refining a broken contract and an unworkable system, rather than, again, flooding them with more people doing it, because you also need more dental practices to accommodate more people and work on the workforce behind it. But what it has identified is that there is a crisis going on. There is a lack of workforce and a lack of establishments and a very broken contract on the NHS at the moment.
Avik, thank you very much indeed. Pleasure speaking to you. Have a good weekend. Dr. Avik Dandapat, a local dentist there, with the pressures on our dental system. Always good to hear your stories as well. And we can add them to the mix here on BBC Radio Berkshire.